Welcome to another Medical Excellence Moment with author, speaker, and physician Dr. Simone Josey. Relevant and practical tips for excellence in patient care, professional development, and leadership training for healthcare providers.
Hello, healthcare professionals. Dr. Simone here. Welcome back to a Medical Excellence Moment. And that's simply where I share in the moment tips to help you be more excellent, efficient, and effective with your patient care. Thank you so very much to all of my returning listeners. I really appreciate it. This podcast is really taking off, and it's because of listeners like you. Continue to comment, continue to share, continue to let me know, give me feedback. I really appreciate hearing from you. As always, I'm excited because we are on a new podcast and we're actually on number 17. Woohoo! So if you haven't already, definitely click the notification tab so that you don't miss out when I upload new podcasts. As it stands, I'm uploading one per week. So every Wednesday, there will be a new podcast available. So I don't want for you to miss out because I have a lot of great content coming. I have some great speakers lined up and you're going to want to be present for the information. So for today's topic, I'm going to be touching on something that doesn't happen extremely frequently in my practice, but it has happened enough in the past for it definitely to be a topic worth discussing. And it's also something that I hear other practitioners have concern about. And so I'm going to touch on it today. Now, before I get too much further into the information, let me just say that we know medicine is a practice. We practice medicine. And even though a lot of the information is science-based, it's scientific, we're dealing with humans. And humans mean that there is a variable aspect to what we do. And although chemistry and biochemistry and biology are at the foundation of what we do, A plus B will always equal C, there is somewhat of a variant, and so you might get a C prime, and sometimes you might get A plus B equals D. And so because of that, then when a patient approaches you sometimes with a question or a concern, you might not know the answer. And that's okay. Let me just let you know that's okay. Now, most of us who are in medicine, we are either type A personalities or we are people who like to be on top of things. We like to be in the know, and that's great. Obviously, as a practitioner, that's important. As a hospital administrator, that is extremely important because our patients depend on us to be the expert. They depend on us to know all things regarding their diagnosis, their treatment plan, the prognosis, the variables, the outcomes, and that's great when you do know all of that. But healthcare professional, we are in a field that is rapidly changing, and we are very fortunate to live in a time where things are dynamic and healthcare is dynamic and science is dynamic, and there's so many awesome innovations and there's so many things that are now available to our patients that weren't available even last month. So because of that, you might come across a time when a patient asks you a question and you're stumped. Now, when I first started practicing, I remember feeling almost like a slight panic or anxiety in that moment when your patient's looking at you and you have your white coat on. It clearly says Dr. Simone Josey on the lab coat, and you are the one in charge. You might have a nurse in there with you or a medical assistant, and your patient's looking to you. Their eyes are wide open. They're waiting for you to weigh in on their question and give them the definitive answer. And in that moment, your mind might go blank. Maybe it's something that is totally foreign to you and you've never actually had to answer that question. Or maybe it's something in the sense of there is a new technique or new procedure or new medication that you haven't heard of yet and they're asking you about it and you don't know the answer. Here's what I like to do in those moments. And it's something that I talk about extensively in my book, More Than Medicine, because like I said, it doesn't always happen. Obviously, the longer I practice, then the more information I acquire, the more knowledge I acquire. However, there are times when patients ask questions. I don't know the answer. And so I like to practice something that I call intellectual honesty. Intellectual honesty. And like I said, it's something I talk about in my book, and I won't go into great detail just because I want for this medical excellence moment to truly be succinct. But the basis of intellectual honesty is just fessing up. It's just fessing up. I remember when I was in college, I pledged a sorority, and one of the mantras that they always used to say, like, they'd ask a question, and if we as the pledges did not know the answer, our big sisters and the dean of pledges, they didn't want for us to BS. They didn't want for us to pretend to know the answer or to make something up on the spot. They definitely didn't want for us to stand there like a deer in headlights. Instead, they wanted for us to respond something along the lines of, I don't know the answer. However, I will research it, and when I do know the answer, I will come back to you with educated information. Now, it wasn't as wordy as that, but that was the gist of the lesson. And I've taken that lesson that I learned in college and I've translated it into my personal as well as my professional life. Your patients, they want to know that not only do you know everything, but if there is a chance that you don't know the answer, they respect honesty. They deserve honesty. And the truth is that we do not operate and exist in a bubble where our patients are beholden to just our information. As much as I loathe when patients print off WebMD and give to me, the truth is that they have access to other information, and they have access to YouTube, they have access to Google, they have access to so many other outlets of information. And so they are going to sometimes fact check. And they're going to see if you're telling the truth or not. And so what you really don't want to do is try and give an answer just to seem as though you know what you're talking about, because it can really damage your patient provider relationship or your patient administrator relationship. And that can also negatively impact the patient engagement, because if they feel as though they can't trust you to be totally upfront and honest with them, then they're not going to feel as though you truly have their best interests at heart. And then that reflects on how they're going to be involved in their own treatment plan, and how much they're going to engage, and how much they're going to be willing to listen to you from here on out. And so everything, of course, impacts patient experience. And so what I have realized is that intellectual honesty is the foundation of my patient-provider relationship. And there are many other things that go along with that, but integrity and intellectual honesty, those are things that I try and hold very, very highly in my own practice. And I encourage you to do the same. So I'm not saying that you always have to admit when you're stumped. I'm not telling you that you have to say, hey, let me go ask my friend. I haven't, looked at that since, chemistry 101 or biochemistry in, med school. I'm not saying you have to do all of that and bear everything, but I am saying that the best way to answer a question when you don't know the answer is to be upfront and honest. And I think that intellectual honesty, which is what I call it, is the best way to handle that. Just say, you know what, Mr. Smith, I'm not quite sure what's going on. I'm not quite sure why things aren't lining up. However, I'm going to do some research, and when I have an answer, I'm going to make sure I come back to you, and I'll let you know where we can go from here on out. And then be done. And your patient will respect you more. They will trust you more, because they know that you are human and you've acknowledged that. But you're going to do all you can to make sure that you give them the most educated information. All right, so I hope that was helpful for you. That's my medical excellence moment for today. Definitely be sure to check back next Wednesday, because we have another podcast coming. All right, and if you have not already, let a friend know about these podcasts. I do them totally for you. Again, thank you so very much to all those who continue to listen every week, those who continue to share and comment and give me feedback. I really appreciate you. Thank you so very much. These podcasts are made possible because of listeners like you. So thank you so very much. And until next time, remember, I am Dr. Simone, and I will either see you at the top or from the top. You decide.
For free professional development resources, visit drsimonesays.com and click the free resources button. This podcast is made possible by the financial support from listeners like you. Stay connected with Dr. Simone on Facebook at Dr. Simone Josey, and on Twitter, Instagram, and Snapchat at Dr. Simone Says.